So what's the future of outpatient physical therapy? So if you just look on the technology side and things like IBM Watson and stuff like that, if you think about it, in outpatient physical therapy, what's the future going to be? The good thing is that if you're a skilled manual therapist and you're showing great outcomes, a computer can't replace your job. In the future, there's going to be a lot of careers, a lot of jobs that are going to be lost due to robots and computers. Just wait, in the next 10, 15 years, there's going to be a lot of people who are going to change careers because a computer or a robot's going to replace them. It's going to create a good kind of controversy, but we're going to have to adapt and change and find another craft. But physical therapists, especially an outpatient manual physical therapist, I think we're safe, because I think a computer can't treat the way we treat. They can't have the thought process, especially for some of these complex cases. It's not going to be like you're going to have a patient who has a disease and they're going to list their symptoms, and the computer is going to run their symptoms through an algorithm and give you 5 diagnoses that you may have. You may have mono, an 85% chance, and then you may have this at 50% chance, and dispose a little pill for you. It's not going to work that way. So I think in the future, physical therapy is going to thrive, because a robot can't replace what we do. Now, the scary thing is that what's going to happen with health insurance and payments, and where are we going to fit in the healthcare model? That's a whole nother lecture that I just talked about. But even with physicians, where are we going to fall in place in the healthcare model to the general public? Physicians really don't respect us. You may have a couple friends who are physicians that recognize what you do, or you may have a physician patient, but in the big picture, they really don't respect us. This year in legislation, they pretty much bashed us when we tried to come out and change our Practice Act in my state. They called us, we're a tool, and they pretty much, actually kind of makes me really mad, and I'm holding it back right now. And they even tried to go as far as, they didn't want us calling us doctor. I was so angry, and I'm holding it back so bad right now when I watch this. But anyway, they don't, in the big picture, they just want to keep us suppressed. We want to be a pawn on the chessboard, or a little tool for their disposal, and that's it. But I tell patients this, I was like, you don't need to go to a physician if you have low back pain and get diagnosed with a diagnosis of low back pain and no way of treating it. They just refer you out. What's the point of that? It probably costs you $1,000. So anyway, the future of healthcare and physical therapy, I think, is great for physical therapists. Now, not everyone's going to thrive. Some guys may get sucked into the ACO model, or some might not want to do the stress of doing a cash-based clinic. But if you're a great outpatient physical therapist and you want that cash-based model and are willing to work for it, I'll give you the blueprint, and I think that you're going to thrive in it, as long as you can show great outcomes and do the main reason of why we're doing this. We're not doing this just to make money. We want to help. We want to create value in our healthcare system, and we can add value to it. We can show great outcomes. So you got to believe in physical therapy. You got to want to be able to work hard and help others and do that. And I think that we can do this, and I think that the cash-based clinic model is going to thrive. You just have to be willing to work hard and show great outcomes. So I could talk on this for hours, but you have to believe in physical therapy. You got to be an expert in outpatient manual therapy. I'll give you the blueprint to thrive, and you just run along with it and get people better. Give your patients the high quality care that they deserve. We'll earn our respect in healthcare. You can't go and just blame other people, blame insurance companies, blame physicians for not respecting us. You got to go out there and show great outcomes, prove them wrong, and you'll earn their respect. And then then we'll take our place and targeting certain niche markets and treating the patients that will best respond to physical therapy. So I could go on forever. Again, I just wanted to speak out a little bit and talk about the future of physical therapy, especially in outpatient, and a few of my thoughts. If you have any questions, concerns, send me an email. Let me know. I'll be glad to answer. Thanks.